Well, welcome everyone. My name is Professor Mary Wiktorowicz, and I'm the Associate Director of the Dahdaleh Institute, and it's so wonderful to see everyone here in person. Today, we're proud to host the 6th Annual Global Health Intern Symposium that'll feature exceptional students who will be showcasing their contributions to global health research. Let's celebrate their journey and progress as the next generation of global health leaders, researchers, and practitioners. And before we get started, we'd like to offer a land acknowledgement. As this is a hybrid event, and some of you are located elsewhere, please take the time to give thanks to the land you're on. So here at the York University campus, we're situated on the traditional territorial area known as Toronto, and we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. We also acknowledge this as traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. So today's symposium could be considered the capstone of the Institute's Global Health Internship program. Students have had the opportunity to hone their critical research skills and pursue meaningful research activities under the guidance of leading global health researchers. The Dahdaleh Institute employs critical problem-solving approaches to pursue effectiveness, equity, and excellence in global health research. As global health leaders, researchers, and practitioners and students, we're all working at the interface between research, policy, and practice to try to address some of the 21st century global health challenges. The program takes an experiential education approach to provide dynamic opportunities for students to work with our faculty and fellows in a professional environment and to support high caliber research in the areas of our current themes that are global health and humanitarianism, planetary health, and global health foresighting. Over the course of this academic year, our interns have undertaken literature reviews, data syntheses, cataloging, content development, stakeholder engagement, and much, much more. We have a great lineup today, but a few of our interns couldn't make it, so I'd like to take a moment to recognize their contributions. Their efforts are deeply appreciated and recognized to advancing the goals of the Institute and in global health research, and hopefully they will have an opportunity to present in the future. So today is a showcase of this year's cohort's hard work. Each intern will describe what they did and learned, the major tasks carried out. They'll share how their work has contributed toward research addressing critical global health challenges. Some of the topics that will be discussed today include social science research approaches to studying tuberculosis, human-centered design in health, community-based approaches to safe water optimization and emergency response strategies in rural areas, as well as global health projects such as communication and the Wellness Impact Lab. We hope their presentations can also inspire other students and faculty to participate in the Institute's Global Health Interns program. So for prospective interns, you can find upcoming opportunities posted on our website under the internship program page. Specifically, we're recruiting numerous positions across disciplines such as global food systems, disease prevention and surveillance research assistant, experiential learning in global health priorities research assistant, stress and disaster research assistant, and many more. So the deadline for these is approaching on Thursday, April 18th, which is tomorrow. So just as in terms of housekeeping, this is a 2-hour event. We'll start with the first 4 presentations, followed by a brief Q&A discussion session, and then we'll take a 10-minute break around 11:55 a.m. We'll then resume at 12:05 with the remaining 3 presentations and conclude with another round of questions and discussion before wrapping up by about 1 p.m. or shortly before. For those who are joining virtually, please remember to keep your microphone muted and use the chat on the raise hand button or the raise hand button. So let's start with the first 4 presentations, and then we'll take questions at the end. So the first one is in person, Gurher Sidhu. And I'm wondering if you'd like to introduce yourself and commence your talk.
Hello everyone, my name is Gurher and I'm a fourth year Global Health student here at York University. And I had the honor of working under Dr. Amrita Daftari as her RA. Specifically, most of my work was centered around managing and extending the presence of a network of social science tuberculosis researchers called SHIP-TB, which is an acronym for Social Science Health Innovation in Tuberculosis. And so again, most of my work was administrative. A lot of it was to do with maintaining our social media presence. So that's things like tweeting. I expanded our presence to LinkedIn, but I'll focus on my favorite parts of what I did this year. So first, in every quarter, we release a newsletter, and for that, we like to create some content highlighting the work of our network. And so back in October, I got to interview social science TB researchers working in Nigeria and Papua New Guinea for our October newsletter. And so this was a really interesting process of navigating time zones, picking the right questions that weren't too open-ended, but weren't closed-ended either, and then ultimately producing an interview. This one is with Dr. Tayosi and Dr. Biata in Nigeria, or their work was centered in Nigeria for this one. And so this was a really excellent experience. As well, back in the summer when I was also in this rate position, I assisted a master's student with her systematic review. And so this year I also worked on preparing that same master's thesis for publication. And so mostly I worked on editing some of the manuscript and ensuring that everything was in check and going through the entire publication process. And I also found that for promotional work of this entire academic network, a lot of it ended up involving video editing, interestingly enough. And so I also had the honor of, for Dr. Amrita, she has a course in which there's a project relating to video editing. I had the honor of being asked to deliver a guest lecture about editing videos. So of course, I'm no professional in that, but for a project such as a third year level course, she wanted the kind of amateur perspective of how to deliver products. And so I was able to deliver this lecture over Zoom, and it was definitely a very special opportunity for someone who's still in undergrad. So what did I learn? Of course, in going through all of the research produced by our network for our quarterly newsletter, that isn't too different from the one that Chana produces for the Dahdaleh Institute. I got to learn a lot about the latest in social science tuberculosis research. I also learned a lot about website management and how to create and deliver email campaigns. I also learned about the very important intersection of social media with academia, which I think a lot of people in academia want to focus on research, but just as important is dissemination, and social media platforms are a great way to do that now. I noticed that we were mostly focused on Twitter, but I realized that maybe we should expand LinkedIn as well. So that's something I learned, the process of understanding where academics are situated online. Also got to learn a lot about the publication process, and finally, again, video editing skills for promotional content. So what is next for me? I will also be continuing in this rate position this summer. Dr. Daftari is still happy to have me, thankfully. And because of the wonderful experiences I gained through this experience, I was also offered for my full-time position this summer to do a policy analyst internship at the Public Health Agency of Canada, specifically in the Dementia Policy Unit, which is quite different from tuberculosis work, but it might be somewhere where my interests lie. So I'm happy to explore this. And finally, throughout the year, I also worked on independent study course and another research project outside of that. So the first one I'll be continuing on to produce a manuscript for is related to physical activity and aging for my independent study. And then this one is a newer project, but I'm working on interviewing professors about their opinions, awareness, and implementation of accessible course design principles at York University. So it's still in the beginning stages, but I am super excited about this project. And I am quite certain that the skills I gained through my rate position were instrumental in what's coming next for me. So thank you so much to Dr. Daftari and the entire Institute for allowing me this wonderful opportunity this year.
It's really excellent, and congrats on your EHAC
Thank
internship.
you.
It's going to be interesting.
Yeah.
Will that be online? Like
it's hybrid. Yeah, but I'll stay in Toronto, but I'm super excited.
Okay, wonderful. All right, so up next is Shamim Samadi, and Laura Rosa Pereira in person. So would you please introduce yourself?
Yes. Hi, everyone. My name is Shamim.
My name is Laura.
And we are Global Health Interns at the Wellness Impact Lab. Supervised by Dr. Harvey Skinner and Susan Harris. We've been working at this lab over the past year now. I started in the summer term and Laura started in the fall winter term. I just wanted to thank everybody at the DI, especially Chana, Teresa, Mary, Fernando, for all your help and support over the year. Honestly, it has created a really amazing experience for us. But to share more about who we are, our lab focuses on addressing climate distress to foster resilience and work on climate action. And our vision is healing ourselves, healing others, and healing our world. So kind of segueing into what we've accomplished over the past year. Myself personally, I have worked with Harvey to review the past 40 years of the drug abuse screening test, which is a screening tool that he published in 1982 that helps patients and assess them of their drug use and misuse. So with the DAST, it is internationally used with over 3,000 citations and 15 plus language adaptations. So we really wanted to look over the past 4 decades and how this research has been utilized in different modes, and as well as how the revised version of the DAST can be implemented into this research and how future research can really benefit from it. So I'm happy to share that we have submitted this review for publish to the Canadian Journal of Addiction, and we actually received a positive response yesterday with some revision suggestions. So over the next term, like over the summer, I'm going to be working with Harvey to do that, not as a race student, but independently. But I'm very much looking forward to that whole process.
And then as for me, I've been supporting the Climate Cafe evaluation project, which our lab is still currently working on. And for anyone who does not know what a Climate Cafe is, because I didn't either going into all of this, a Climate Cafe is an informal space where people can drop in and sort of talk about any feelings, any thoughts they have regarding climate change. And the hope is that by talking about it, people can process their emotions and cope better with any climate distress that they may be experiencing. And the Wellness Impact Lab has hosted climate cafes in the past, and we hope to host more in the future. But in the past few months, we've been focused more on the evaluation piece, just because we found that to be lacking in the literature. So thankfully, we partnered with a great community organization called Carbon Conversations TO or Toronto, and they kindly agreed to share the feedback data that they have because they host regular climate cafes with us, and then that's what I analyzed. And it was my first time doing a thematic analysis, so that was a very fun learning experience. There were roughly 55 responses across the span of 2 years that were collected. So I looked at that, I looked at the questions that they asked, and I identified the ones that would be most appropriate for a thematic analysis. And then I did sort of putting all the responses, identifying themes and cosmic codes. And lastly, I produced a summary report that I shared back with our team, and that I'll be sharing with Carbon Conversations Toronto at the end of this month. So I'm looking forward to that. The results were pretty positive. People tend to really like climate cafes. It tends to be helpful. So it's good to have that evaluation piece, and it's going to help us with the evaluation framework that we're currently working on for the climate cafes that we have planned in the future. And then the last project that our lab, not the last, there were a lot of projects, but one that we wanted to highlight that our lab worked on collectively was the Listening to the Nerd series. And that was a special DI series consisting of 3 seminars that we hosted earlier this year. For anyone who didn't hear about it, it was led by Jennifer Coyero, Star Prawati, and Harvey Skinner, and featured some amazing Indigenous guest speakers. Shamim and I did a lot of the promotion and dissemination work for that, which was really fun. I won't talk too much more about it just for the sake of time, but if you're interested, the event recaps will be posted on the website, and I think the Zoom recordings will also be on it. So if you want to watch that back, I highly recommend. And that segues into what we sort of learned this year. I think it's been a very eventful year, and Shamim and I have learned a lot, and definitely learned a lot about climate change and intersection with mental health. But sort of the key overall lessons for me have been the value of collaborating with people from different disciplines. Our lab was established last summer, and it's grown a lot since its inception. We have a lot of members from different backgrounds, different disciplines, and they all have very diverse skill sets. So I think for Shamim and I, it's been really great to hear their insights and like access their expertise. It's been definitely an enriching experience. And another key lesson that was highlighted through the Listening to the Nerd series was how lived experiences complement knowledge synthesis and can inform evidence-based research and practices, especially focusing on climate change and climate distress. And I think, again, like the series really highlighted that because we listen to Indigenous voices, what they know about the climate. They are the most affected by climate change, and they know a lot about and can teach us a lot about living more sustainably. So that was very exciting.
Yeah, and the next lesson, but definitely not the last lesson that we learned throughout this experience, is the importance of being adaptable no matter where you are, and definitely using your creativity as an asset. So being involved in this project with Harvey and Susan over the past year, it's really allowed us to cultivate a vision and bring it into action, but especially like different types of barriers, with everything being hybrid and working with so many different people, different mishaps can come by. So definitely learning how to navigate those and creating the most successful outcome is really a valuable thing that Laura and I have learned.
And then in terms of next plan, so for me, I will be continuing to support the Climate Cafe Evaluation Project. And I'm very grateful to have been part of the team, but I also learned a lot in the past year about what I want to do in the future. So I will be exploring other opportunities. So I'll be continuing just as a volunteer. I won't be returning as a race student. I'm very happy to still be on the team. And then I'll be entering the fourth and final year of the Global Health Program and possibly completing my practical 25 term, which is then I'll be graduating in the spring of 2025.
Yeah, and I'll be graduating from a Bachelor of Science in Honor Specialized Kinesiology in the fall of 2024. I won't be coming back as a race student, but I will be supporting Harvey and continuing with the DAS manuscript, working on the revisions and hopefully publishing over the next couple of months. We were also planning on potentially doing a language adaptation scoping review, but we'll see how that process goes depending on the manuscript that we're currently publishing. I'll also be applying to dental school for the fall of 2025, so working on those applications over the summer and hopefully all going well there. Just like as a last note, I wanted to say with all the projects that are going on, the Wellness Impact Lab is continuing and thriving. So definitely with the climate cafes, we wanted to involve the DI or involve other students. So I just wanted to encourage everyone to stay on the lookout for those informations coming up in the next couple months. Yeah, thank you so much.
Fantastic. Both so much. Okay, wonderful. So moving along, we have Shaista Alokozai virtually. Or do we? Yes.
Let me know when you want to move to the next slide.
Okay.
Sorry about that. Hello, everyone. My name is Shaista Alokozai. I would like to extend my gratitude to Teresa, Hannah, and the Institute for the opportunity to serve as the Dissemination and Design Research Assistant. Moving on to the next slide. My time here at the Dahdaleh Institute, I managed several responsibilities. For example, I was in charge of writing both weekly and monthly newsletters through a special tool called HubSpot. These newsletters are the ones that you receive at the beginning of each week, which focus on current global health news, institute events, opportunities, and publications. I also introduced new members of the Institute within these newsletters. Another role that I cherished was writing concise event recaps, which allowed me to attend various seminars, share key insights without revealing too much information. Hopefully, this encouraged you as readers to view the full recordings in case you missed the event. Additionally, I provided administrative support by maintaining logs on Airtable, which is a database that we use here at the Institute. I also helped update the Institute's website, create graphic content for our social media announcements, and help set up event reminders on the social platform and email to ensure smooth engagement. Next slide, please. My time at the Dahdaleh has been immensely educational. I have improved greatly in writing and writing professionally through various outlets like newsletter and event summaries and other writing projects, whereas attending events and interacting with Institute members has enriched my understanding of global health research. I learned so much, and one of my favorite seminars so far was by community fellow Sarah Ferwadi. She explored the universal impact of global climate change on mental health, highlighting the relationship between culture, environment, and community well-being. I really liked how she connected her research to her background, which added a great perspective. Overall, I really enjoyed how unique each seminars were, and I'm really grateful for all the knowledge that I've gained since last September. Furthermore, now I'm much more comfortable with using tools like Airtable and WordPress, which are used daily here to help organize various information and make changes to the Institute's website. And moving on to the last slide, as my role at the Dahdaleh concludes, I'm eager to apply these skills in a new position, potentially this summer. I'm also preparing to enter my final year in the Global Health undergraduate program, where I plan to complete my practicum here at the Dahdaleh Institute. Thank you once again to Teresa, Hannah, for your guidance and support, to the Institute for this incredible opportunity, and thank you everyone for listening.
Thank you so much, Shaista. Wonderful to see all the experience you've had and the skills you've developed. So our next student is Gaurika Agarwal. Please introduce yourself.
Good morning, everyone. My name is Gaurika Agarwal, and I was working as a Global Health Intern and a front-end development intern for the SATS lab. And so I will be presenting on my presentation on topic design for global health and the SATS lab. So I was tasked with two main things during this internship. First was redesigning the website for Social and Technological Systems Lab, or the SATS lab. And second was designing posters for the various researchers going under the Dahdaleh Institute. So for the SATS website, the first step in creating SATS website was going through the previous website and recognizing what changes had to be made, what should be kept, what should be removed, and also taking feedback from Dr. Desai on what she wanted to add to the website. And so following that, I made sort of a wireframe, something like this. First, I sketched out these ideas on a sketchbook and then translated them into high fidelity wireframes on Figma. Wireframes are usually considered like the skeleton of a website. They kind of are just like building blocks on what the website will look like in the future once we add stylistic features like typography, color, and content. And this was sort of the mock-up that I came up with. For the color scheme, I stuck to the color scheme of the SATS Labs logo, which was blue and yellow. And again, the main feedback that I got from Dr. Desai was to make the website as user-friendly as possible, and so that anyone who comes on the website is easily able to navigate through the pages. So that was my main goal while designing this. Currently, we're still in the final stages of finalizing the website, and we are still in the process of choosing which platform we want to stick with. During this internship, I also learned how to use different website builders and platforms such as Webflow, Wix, Squarespace, and WordPress. And yeah, it was a very good learning experience. My second task was designing posters for AI for PEP and Shift TV. So these are a few of the early iterations I did for the poster for AI for PEP. The main color scheme we stuck with was a dark blue and light blue gradient, which is similar to the color scheme they have on their website. We went with various typographic formats, weights, and layouts. And the main brief I got was that to make it like as aesthetically pleasing as possible, but also make it informative. So the small paragraph on the poster gives you a little information about what the research is and what was being conducted. And yeah, the rest is just basically stylistic features. For the illustration, I went with an illustration of a brain with sort of electrical nodes to show the combination of human and artificial intelligence. And overall, we kept the text very simple, but adding a pop-up color through the different logos on the poster. We're currently in the process of creating a poster for Shift TV. These are again a few of the early iterations. This poster is not as informative, but more design focused. And we are exploring different illustrations and typographic layouts. So hopefully we'll be finalizing this poster soon as well. As for my key learnings from this internship was a highly educational learning experience and an opportunity which I'm going to cherish forever, as it provided me with real world design experience, as well as the chance to enhance my design thinking skills and also deepen my understanding of colors, contrast, and typography. I've also learned to design using different website platforms such as Wix, WordPress, Squarespace, and Webflow. And all the knowledge and skills I've acquired during this internship are going to help me grow as a designer, and something I will use even when I deal with clients in a real world design setting. As for the future, my goal is to work consistently on improving my design skills, possibly doing an online course to learn front-end development so that I can become a more well-rounded UI UX designer and developer. And I'm keen to take more design-related projects during the fall semester as well as the winter semester. Thank you, everyone. And I would really like to thank Teresa and Hannah for all their support throughout all the poster designs and versions, and Dr. Desai for all your support for the website. Thank you so much.
Thank you, Gaurika, and great to see you using your skills and contributing across so many projects. So, wonderful. Okay, so we've heard 4 excellent themes and projects, and there are more projects within each of the student themes. So I'm wondering now if anyone has any questions. could open it up for discussion. And well, maybe I'll start with the first one. So Laura, you mentioned in your Climate Cafe evaluation that across those discussions, you've had 55 responses and you're going to be doing a thematic analysis. Do you plan to develop that into a publication?
No, it would be great to, but just because the data is not ours, since we got it from Conversations Toronto, for confidentiality reasons, I think that I created the summary report, like I already conducted the thematic analysis and produced the report. But it would just sort of be for us, for our insights, for the framework that we're developing, and then to also report back to them. But I
I
think
see.
we would be allowed to publish because of confidentiality reasons.
Right, right.
But to follow up on that, the evaluation that Laura, Susan, and other members of our lab are actually working to create for our own climate cafes may potentially use for a future publication on kind of like the efficacy of these types of climate distress interventions. Because that's kind of like the focal point of our lab. And we have another research fellow that's working with us at the Wellness Impact Lab. Her name is Katie Newman, and she's currently working on a publication that assesses all types of climate distress interventions and specifically looking at one type of model. So that's something that's kind of in the works, and this evaluation without the help of Laura kind of couldn't be made, because especially looking at current types of evaluations that were already in place with Carbon Conversations, we kind of looked at what faults it might have for people that are being involved and how can we make it better, so that you could also follow up with people who are involved in climate cafes to see if there could even potentially be a long-term effect that positively affected.
Right, right. Yeah, no, I think that's really, really promising work because you know, conversations and social interactions, all of that can be very therapeutic. And so we're grappling with an existential crisis, as we all know. So yeah, that could be really, really helpful. So great to hear about that. Yeah, we're laying the groundwork for you know, for building on it. Yeah. Yeah, absolutely. Okay, well, any questions? Because I am ready with my next one as well, unless anyone would like to go ahead. So, Gurher, you had talked about looking at mental health associated with TB. Can you talk a little bit? You haven't really talked so much about that. Like, what are the parameters of probing into that area, and what have you found?
Right, so just for some context, the research was specifically examining what interventions existed relating to mental health in tuberculosis care in the South Asian region. I think the important things to consider, it's not really talked about that much, like it's not really a factor, especially in situations where even things like medication adherence and other factors are like probably considered more pressing. So then there's not like specific interventions for mental health when something so basic isn't being considered. I think that's like generally what we've found, but I think there should also be more consideration that by looking at the mental health and caring for the mental health of TB patients, they might also be more likely to follow the appropriate regimens and all that. But overall, the findings were that there isn't too much of a discussion of patients' mental health, or at least specific interventions that could support patients' mental health in specifically the South Asian region. That's our findings so far.
Yeah, no, that's really important because I think it's almost something that needs to be done in parallel, right? And as you should say, it could support adherence. Exactly. So we need some models, and maybe your research will uncover some.
Yeah, potentially. So I mean, like we're finding that there's not that many, and so the findings weren't particularly like exciting, but I think it's important to know that it doesn't exist so much, so that eventually there's a rationale for implementing more. That's the hope.
A case to be made even for starting some research.
Yes.
You know, develop
Exactly.
some pilot studies and all of that.
Yeah. It was a great experience for sure.
Yeah. Okay, well, thank you so much for that.
I'd love to jump
Not
in with
thinking-
a question.
Yeah.
That's all
Does
right.
anyone online? Sorry, I haven't been looking.
Yeah, I'd love to jump in with one.
Please.
Opening up to the panel as a whole, I work in emergency management with a focus on public health and emergency medical services. And I'm wondering, just broadly, if anyone's research on climate change, on TB, on epidemiology, has anyone's research kind of identified any intersections between health and emergency management in these kind of niche fields when you're talking about like climate cafes or TB research, or as Mary just mentioned, mental health? Anything new in terms of research that has cropped up that you found, or any linkages that you think would be interesting to follow in the future? Thanks.
I think that's a really good question, Tiana. I read your name, but it's really small here. I know that we talked a lot about climate change and mental health and sort of the impacts of environmental degradation. And one really interesting theme that came up, it's not something that I went into too much depth on, like in my research, but that was discussed, was sort of the impact of wildfires and any sort of natural disaster on that sort of migration, and how we're talking a lot about obviously health and refugee health, and how nowadays and in the future there will be more climate refugees, so to speak, and how like that impacts them, because obviously everyone experiences some level of climate anxiety, or most people do, but it's very different to the climate anxiety that most of us experience sort of here in the South, and we don't see the like direct impact of environmental degradation or natural disasters. And then there's a much stronger impact on people that are actually like whose land is completely destroyed. And I know that Sarah Fawadi's like seminar really touched on that. Like we see that you lose so much in cultural identity and so much in sort of your mental health when the land that you grew up on and that you call home is completely destroyed. So that's, I think, research that's I know is being done a lot, and I would be very interested to read more on, and sort of I hope it's highlighted more in the future, because there's such a big connection. And if we don't address climate change, then one of the things are going to keep getting destroyed. People will have to move due to environmental degradation, due to natural disasters, and I wonder it's going to have such a big impact for sure on people's health, and how they identify like their sense of identity. So that's sort of what we've seen. Like it's very important, and I think with Indigenous populations here too, it's so important how we respond to climate emergencies and the wildfires. Like they're the most impacted by it, and the government knows every year that there's a season for wildfires, and it still feels like we're not prepared. Like the emergency preparedness is not strong enough, and people still have to relocate, and that again has such a big impact, especially if you consider the historical trauma that they've been put through, and then having to relocate again, being forced away from their communities. Like that must have such a big impact on people's health.
Yeah, those are all very good points, and I think it really does speak to that broader topic of like community resilience, adaptive capacity, and basically building the community's preparedness before something like that occurs, so that when it occurs, it doesn't come as necessarily so much of a surprise or a shock to them. And I think that would probably go a long way too in mitigating kind of the issues that you just mentioned. So yeah, very interesting. Thanks for touching on that.
Yeah, so true. People in the global South, they're actually, for us, we might learn about it, what's happening in the Arctic and elsewhere, but people in the global South, they're already feeling it, and it's already impacting their lives, and they're already climate refugees. So yeah, it's great to see that kind of work done, and it's trying to address that. Questions? So the design students, both of you, really supported, these knowledge mobilization on these projects. Can you talk about kind of, the most innovative things that you learned, and, how being able to apply yourself to these projects has made a difference in your learning?
Definitely. Like I never knew about these projects that were going on. Once I was designing for them, I was researching about them because I was going through their website, learning about them, so that I could design the poster appropriate to their institute. And you actually learn about all the work that's being done. And then overall, as I was making each iteration and each version, I was getting feedback, and then I would see it from a different perspective, like how Hannah would see it, how Teresa would see it. They would both see it differently as well. So that would also made me think, oh, yeah, this can be changed, or these things can be looked at differently. So it definitely helped me learn about how collaboratively you can work on a design project and like come to this final conclusion, make something that everyone would like. So like designing for everyone as a whole and not for individual goals. It was very interesting.
Yeah, and having worked with, colleagues of yours in the design area, I find when you apply yourself to it, as researchers, when we see the results kind of presented in a very interesting format, it seems almost more impactful, and also being able to be conveyed in almost images, not just images, but really crisp, concise text. And so I think it's that added, value that, can sometimes make the difference for the research having an impact somewhere and not. So yeah, we look forward to your honing your skills further. And also for Gaurika, you're also, you're still online. Oh, sorry, no. I'm sorry. Shaista, yeah, you're also a design student, right?
Yes.
Yeah, so can you reflect on your experience a little bit in terms of, what were some of your biggest takeaways and learning moments from, being involved in the newsletter and other kinds of Stats Lab and so on? Sorry, you weren't involved in the news. You were mostly involved in the newsletter. That's right.
Yeah, for me, it was like a new thing that I had to learn. But what helped me the most, I would say, is how I had to ask questions whenever I was confused on certain things. So Hannah and Teresa were really supporting for me. So whenever, like for example, the HubSpot tool, that was something that I've never worked with, but working like a day's like 2 hours with Hannah especially, and asking questions to Teresa really enhanced my learning in that tool. But for me, just like asking questions and getting to know the tool day by day.
Great, great. And do you see yourself applying those skills in the future again?
Definitely, if I apply to a similar position, I can see myself using Airtables as well as HubSpot to work at the Dahdaleh.
Right, and hopefully in your future career, I imagine these are skills that will, you'll have an opportunity to use again.
Definitely.
Yeah, great. Thank you so much. Any other final comments or questions for this group? Okay, well, we're all very impressed with your contributions and, look forward to your continued contributions in the future. So I would suggest we take a 10-minute break then. Maybe we could come back closer to 5 to 11:55 and resume for our next group of presenters. So we get started then. Okay, well, welcome back, everyone. So we're now ready to get started with our second set of student presenters. And I'd like Yashi Papola to please go ahead. Yashi?
So I will first take a moment to thank Dahdaleh Institute, the symposium organizers, and my supervisor, Dr. Shifin Desai, for the opportunity to present to me and to be part of this project. Since September 2023, I have been working as a research assistant. I've been working as a research assistant under the supervision of Dr. Shifin Desai at the Social and Technological Systems Lab here at York University. So the project aims to study the experiences and emotions of adults with chronic pain to measure stress in correlation to the subject's heart rate variability. 1 in 5 adults in the world suffer with chronic pain, and since physiotherapy is often not covered by the health insurance, it remains an unaffordable option. Thus, understanding the emotions people experience during pain and how they manage them could be used in designing future technologies for chronic pain management. So after joining this project, I began by conducting a qualitative analysis, which involved creating reporting schemes on the basis of the behavioral data that was collected through interviews. This coding and analysis was done on the Observer XD. Later, we imported the sensor data, which was collected through the BioPack 40 sensor electrodes that were fixed on the participant's body. The electrodes help measure the heart rate variability and to find if there is any correlation with their experiences. Currently, we are also trying to check the feasibility of using behavioral, physiological, and facial expression data and see if that allows us to correlate their pain experiences with heart rate variability and emotions. However, it is important to note that the use of analysis done by the face reader software poses some limitations. The room where the interviews were conducted did not have even lighting, and the angle at which the camera was placed prevented the software from recognizing every facial expression of the participant. Due to these reasons, the collected data remains unreliable. So there have been many takeaways from this project, but some of the most important things I learned are how to conduct a thorough qualitative and quantitative analysis, how to develop coding schemes that help better understand the various patterns in user behavior. Moreover, I learned how to use softwares from Knowledge, that is the Observer XD and Fix Reader. While they involve intensively referring to the manual and going back and forth with the Knowledge team, I also got to learn a great tool that will be useful for future research studies or projects. Lastly, I also learned about the triangulation of quantitative and qualitative data, which is a unique way of analysis that I haven't used before, and that can help in obtaining reliable observations and results for research purposes. Although I'm very close to finishing my role here, I plan to complete setting up of the process while also extensively documenting it. Post-internship, I would love to work on similar opportunities that involve human-centric, utilizing human-centric design approach to address social challenges. I would also like to apply these unique ways to analyze data for further projects and studies. Lastly, I'm hoping to graduate with a degree in Bachelor's of Design by 2025 and be able to apply all my knowledge and skills that were learned here working as a research assistant. Thank you.
Okay, thank you so much, Yashi. Sounds like you've had a very rewarding experience. So next up is Ravjot Chana, who's joining virtually.
All right, hello everyone. My name is Ravjot, and I'll be talking about my experience as a research assistant for the Safe Water Optimization Tool project. So in this role, I did a lot of examining the literature surrounding our research topic. So this involved analyzing and synthesizing journal articles and documents and extracting the key insights from them and then adding them into our literature database. I was also able to use citation software like Zotero to keep track of the references and make sure that they were organized. Another one of my main tasks was to condense and summarize the findings and put them into a literature review. And this process involved identifying the recurring themes and explaining each one in greater detail. So through my analysis, I uncovered key themes such as issues with water quantity, water quality, associated health risks, and perspectives of First Nation communities about water quality. Many communities in the Canadian North are at risk of water quantity issues. So water quantity issues are made worse by the increasing population, the older infrastructure, and the higher costs involved. And inadequate water supply can lead to poor hygiene conditions and can make it difficult to comply with public health recommendations on hygiene. In terms of water quality, issues with corrosion from premise plumbing and free chlorine levels being below Health Canada recommendations were areas of concern. And then the main issues identified by community members include issues with water quantity and contamination of source water. So through this experience, I learned how to synthesize and summarize literature. I gained valuable insights into the challenges surrounding drinking water in the Canadian North, and I learned how to effectively synthesize and extract key themes from literature, which are all key skills that are very valuable for as I continue my academic journey. And then looking ahead, I'm excited to continue my work throughout the summer with a focus on drinking water quality issues in Ontario. Our next steps for the project would involve creating a research question and conducting a more systemic review of the literature. Thank you so much for listening to our presentation.
Okay, well, thank you so much, Ravjot. That really interesting and great to learn that you're developing your research skills as you go along. So our next presenter is Amen Okungbowa, also virtual. So please go ahead and introduce yourself.
All right. Hi, everyone. My name is Amen, and I work as a research assistant under Dr. Jeannie Samuel, and I helped with a project that explores building equitable and resilient community-based emergency response strategies in rural Guatemala. So one of the significant impacts of climate change on marginalized communities can be seen in the image on the right. Here it shows extreme flooding caused by Hurricanes Eta and Iota in 2020 in Guatemala, which has displaced over 300,000 people in this country. One area that was disproportionately affected was Alta Verapaz, a region which has a large indigenous community. In light of this project sought to better understand indigenous community responses in this region to such extreme ecological disasters and at the nexus of public health crises, particularly the pandemic. So on my end, I mostly helped with conducting literature review in terms of theoretical frameworks used in this project, like for example, organized abandonment. And I also helped supporting the write-up of a grant proposal that explores the connection between maternal health, mental health, and climate change. So far in this journey, one key thing that I've learned was that institutional neglect truly and deeply exacerbates the effects of emergency disasters as seen in Alta Verapaz. Because even after 3 years, extreme weather events and flooding still impact indigenous communities in Alta Verapaz, and at the same time, they don't receive adequate government support during these very difficult times. And moreover, this does not mean that the communities have not developed their own coping strategies with such challenges, but without the additional government help that they need, it makes their living realities much harsher. And also helping out with the proposal also allowed me to better understand the nuanced ways that climate change can threaten maternal health for Indigenous women in Guatemala. For example, after reading the literature, I came to a realization that flooding can destroy crops and herbs used by community midwives, known as comadronas, that are really critical in maternal care. And this has immense consequences, given that most Indigenous women in Guatemala rely on comadronas for support in child delivery and family planning. So I want to say thank you for Dr. Jeannie Samuel and the Institute for providing me this opportunity to really explore and delve into this area more. And hopefully I can continue to explore this issue in terms of climate change and the effects it has on Indigenous communities in Guatemala, and perhaps look at it from a global scale as well. And right now, currently I'm preparing for my graduation for the biology program. So I will be looking at postgraduate options. But yeah, thank you.
Okay, thank you so much, all three, for those great presentations, and wonderful to learn about your projects and how they've expanded your both skill set and understanding of global health areas. Anyone have any questions they'd like to start off with? Okay, well, maybe I can start with Yashi, who is working on developing methods for analyzing experiences with chronic pain. So I'm wondering, in terms of the content of your work, how were you able to leverage some of the design tools to, move this area forward in terms of chronic pain? Oh, I'm sorry. There you are. Yeah. Oh, I'm just, you've applied design technologies to address the area of addressing chronic pain. So just from your perspective, what can you take away from how design can support addressing?
So what I was doing here was more in terms of the research, and I feel being a design student, I am really interested in interaction designing, and that involves a lot of research work. We've done like surface level interviews, and what we get is we've done interviews before, but I think what we get is like surface level information. And what I feel my biggest takeaway was learning about how different, how you can apply these unique ways of research, like I mentioned, the triangulation of quantitative and qualitative data. So these kind of skills would definitely help me with my research work or any other project that I take up. So I feel that is one of the things of how you can get reliable data out of the research that you do.
Yes, that's a really good point. I think as researchers, we often, when we talk about, of course, we always have to, talk about what are the limitations of our research approaches. And oftentimes, that is one way we can address them. If, we don't have, say, a full set of interviews we wanted to conduct, we can go to the documents or vice versa. And so that is a way to strengthen your research. So yeah, it's great to learn that. You've learned that early on. Wonderful. Okay, thanks so much. Just go ahead.
Just first off, a warm thanks and congratulations to all the interns for wonderful work that they've done this semester. And I have a question I'll pose to the representative, Yashi. You've done some really interesting research and engagement on projects over the course of your internships. And I'm wondering, what are some of the concrete ways that it's helped you in your coursework, your academic work, outside of the internship? And I open it up to anybody.
Yeah, I can answer this question. So I think throughout your academic journey, being able to really read literature and find the main themes, the main components, and kind of putting that into paper and presenting is very important. And for me, especially as a global health student, a lot of our work centers around this. So just this experience has really helped me learn or kind of enhance these skills. Yeah.
Yes, as I think, as you were saying, research synthesis, which it's not an automatic skill, right? It's something you have to develop and work toward. I even see at the master's and doctoral level, some students that haven't really done it, they can struggle with it. So yeah, I can see how that could really help you in your future academic pursuits. Anyone else? Yeah, you would ask this to everyone, right, Imran? So maybe if all of you could speak up, at least in the second half.
Sorry, can you repeat the question?
The question was, that meant how has the work you've done for your internship, how has that helped you in your coursework outside of the internship, so your regular classes and whatnot?
Yeah, I feel like for me personally, from an individual standpoint, it helped me in terms of time management and just being more flexible because in regular coursework, it's really structured. You have specific timelines, but I feel like in research, you have to be self-motivated, but at the same time, really achieve those deliverables that you're putting down. So I feel like it was helpful in that sense. And also for me, because I come from a science background, we tend to really look at like the molecules, the chemical compounds and all that stuff in terms of health. But going through this project, it really helped me to see the human aspect of, you know, climate change and the effects it has on individuals. And it also made me realize that these things that are affecting health, it's not as distant as we think it may seem. Like it could easily been us that's going through those things. It's just that it hasn't reached to us in that type of level. So I just feel like this experience has really taught me that it's not only just articles that I'm reading, it's also real lives that I'm also um, under real life stories that I'm also hearing of. Yeah.
Yeah, exactly. Putting a face to the problem, so to speak. Yeah. It's great.
I just wanted to add, I feel like global health is a very intersectional field, and that's why I feel like I'm super grateful that the DI kind of offers a program like this, because at first I kind of thought it was only for global health students, but myself, I'm a kinesiology student. I know there's design students involved, many biology students, and I know so much more. So it's definitely interesting that like there are so many different types of research being done where people can apply their different backgrounds to it, but definitely because like the research itself is so intersectional where you're also interacting with so many other people from different backgrounds, you learn more than just how to conduct the research itself. But kind of like how you're saying, I feel like for myself personally, the application falls into how I would now continue moving forward with future projects. So kind of like this independent research study, I was working on it last year, but we kind of paused it because I felt like, not that I felt like I wasn't knowing exactly how to follow through with it, but it was such a big topic. It was anti-trafficking in the Olympic Games. So looking at many types of different like health policies, but also looking at more legal policies. And because it's such a global health issue, I felt like I didn't know exactly how to tackle it. And of course, working with different supervisors and different people in research, you learn so much. But I feel like as I've also gone through this rate position, I've learned really how to like search after the things that I need in order to accomplish that, which I feel like at an undergraduate level, depending on the courses that you're in, they're more kind of like presenting the knowledge and you have to digest that knowledge and then learn what you want to do after it. But I think in order to kind of cultivate thought leaders, you need to be faced into those types of situations where you're doing more problem-based learning and learning how to kind of, I guess, engage your mind into those things. So that's definitely something that I learned throughout my position.
Yeah, and that's a really good point that global health issues are very multidisciplinary. You can use so many different lenses to look at an issue and combine them sometimes to for you, you know, the most unique insights are when you combine disciplines. Yeah. That's really an important thing.
Tina had a question.
Yeah, always. Yeah, go ahead, Tiana.
It's a question for Ahmed.
Hi, sorry, it just took me a second to put my camera on there. Yeah, I was just curious, what central community response themes did your research identify, and which ones stood out to you the most? It sounds like a very interesting research project and one that would be applicable in different contexts as well, because oftentimes if you're looking at response themes that aren't coming from traditional institutions or coming from the community, grassroots, as opposed to top down, you'll get very innovative yet useful and practical strategies that can be implemented in a wide range of contexts. So I'm really curious to hear which ones you found fascinating, which ones cropped up in your research.
Yeah, so for me, I did most of the theoretical framework of the research. So I didn't have the chance to like actually go to Guatemala, see how the communities are surviving and all that. But I'll say based on the discussions that I've had with my supervisor, I will say key themes would be obviously like social cohesion and community resilience. And also another key aspect that kind of stood out to me is that even though these communities have been historically underprivileged and been marginalized, they always have a central way of coping with challenges. That's why, like indigenous communities worldwide, they have been able to survive for centuries. They always have, like, including the one in Guatemala and specifically in Alta Verapaz, they found ways to have to support each other, just on a day-to-day basis, and just trying to make the best of each of their circumstances. So yeah, those are key things that I found, and I feel like I'm still learning. There's still a lot more to learn about, but yeah, those were like key responses that stood out to me, and it also made me realize that these are themes that indigenous communities worldwide, also foster. So yeah, that makes sense.
Yeah, of course. Thanks very much.
Well, I guess we could ask if anyone has any other questions or reflections, suggestions for the future.
I guess I have a question if anybody wants to answer, and this is open to, I guess, like other, not just like interns, but working in a global health type of field, what do you think is like the hardest part throughout your own? Because everybody comes from different backgrounds, but I feel like it's nice to sometimes hear challenges and how people overcome.
Did everyone hear that? Yeah.
My reflection on that is the biggest challenges are two sides of the journey. Right? The first challenge is finding good questions. Okay? There's a lot of things that inform about our biases and experiences that are really important questions, but they may not be as relevant as it could be compared to questions that are coming out of communities affected by crises, people who are working with there. And so finding the right questions, that's always a really hard challenge, and being careful to not get, too led astray by your own biases. And you're asking an important question that has relevance, have impact to humans. That's one thing. The other side is once you get through to assuming you can design good research, implement it, and analyze and generate something, is getting into right, or getting something that's translating your research into something that is functional and fits into the ways of working in whatever particular area you're interacting with. That's really challenging. Oftentimes, the incentives, especially in university, are not aligned for doing that. So you get, you do some great research, you publish a paper, and you kind of stops there. But there's so much potential for what impact that could have. Then if we can just find ways of scaling it and integrating it into ways of working. But there's not a lot of good incentives, or we don't even really know how to do a lot of this, right? So that's another set of challenges.
A great point in Ren, and that includes the partners, right? If you want to make impact on the ground somewhere, well, then you can't come in as someone from the outside and assume to know it all. That happens, and that's been a really it's a problem in addressing issues. You have to work with people who are intimately aware of what the issues are. So yes, that challenge as well, and finding good partners and having good relationships and all of that. So for sure.
Yeah, it's really important, like asking the right questions, but also being at the right place or trying to get yourself at the right place. That's something that I've definitely had to learn, like over the course of my undergrad, just like even navigating like something as simple as like York and like how you can like teach in that. But I have noticed that like having a center such as like the DI really allows for that, and like to be able to like connect with other people. And I was telling Hannah and Teresa this, I was just like, I wish there was a time to like consistently have like more events where like whole lab can get together. Post pandemic, like it's a little bit hard to like transition into that, but yeah. I mean, kind of like a follow-up question, like I've always been curious to know like what people deem as how to learn to ask the good questions. So if you have anything to share about that, that would
You know, asking questions is an iterative process, right? Like it takes time to articulate a question particularly well, right? So you have to have the right kind of, you have to be in the right milieu to like, be able to articulate the question, like get feedback that helps you refine it, make it more precise and meaningful. So that could be, you need to have the academic people around to tie it to the right frameworks and everything and methods on you know, address it. As Mary was saying, you have to have that ground truth component. Is this a relevant question? Is this actually what you're doing? So it's about cultivating those kinds of communities where you're bringing these people together and then having, as you say, like these consistent dialogues, right? Where you're presenting ideas, refining questions, and getting to something new. It's a process.
Thank you.
Yes, and I think oftentimes we're the ones with the resources, they have the needs. And so how do we, you know, how can we leverage what we have to support them? And, you know, for example, in Guatemala, understanding what's going on, you know, with the communities. And then I'm wondering if you would like to elaborate on that a little bit. Or, yeah, maybe start, just see if, and then I see Rupsha has a question, but just.
Yes, sorry, can you repeat the question?
Oh, it's just, it's kind of dovetails on Imran's question around, you know, some of the challenges. And so, for example, I was just elaborating a bit on your experience working with the midwives in Guatemala and sort of on the ground what they've taught you and how that's supported sort of your next iterative steps in your research.
Yeah, so in terms of the midwives, that whole area about maternal health, mental health, and climate change is still something that we plan on exploring more in the project. But I feel like just reading what's already there and just seeing what's going on, I noticed that it's really important to like really have an open mind of what nuances to their experiences of people, indigenous people in Guatemala are experiencing. So like, for example, like we had this conversation one time how even though there's a lot of literature on the climate change effects on indigenous mental health, but there's not a lot of literature on in terms of like women and indigenous women in Guatemala, and just being like cognizant of not trying to superimpose another community experience on top of a different community. So even though I'm kind of going off of a tangent, but like what one key thing that I learned is that it's important to look at the nuances, but at the end of the day, trying to like combine everything to extrapolate certain themes and how like certain structures like capitalism and how like the whole pursuit of just like, you know, profit over sustainability is really driving these challenges that indigenous community and particularly indigenous women are experiencing in Guatemala. So yeah.
Okay, thank you. Yeah, for sure. All right, Rupsha, I saw your hand up earlier.
Yeah, I just wanted to respond to some of the provocations that were put out. I apologize, my camera is glitching right now. It actually won't turn on. I'm not sure what's going on. So I'm just here off camera. But I just wanted to acknowledge the fact that like trust between you and the people that you're working with is very important. And that is also like one of the challenges, I think, because trust can change. It's not something that's like concrete and there from the start, and guaranteed. For instance, I work with people living with dementia. I just finished defending my master's thesis, Master of Design student. And, you know, the trust between me and my participant, it changed almost daily. And it's really important to also acknowledge that like the people that you're working with, their lived experience is also expertise. So that was one of the things that was challenging, but once there was trust and once we sort of acknowledged, our differences, it led to some meaningful interviews and insights. And in terms of creating good research questions too, I think it sometimes comes from the participants, them asking or also offering information themselves that you didn't think to ask or you didn't consider. So that protocol is always evolving, and I think the protocol creation sort of evolves with the research as well.
Yeah, those are great points. Thank you for that, Rosa. Okay. Thoughts or any students would like to comment on Imran's question, challenges? Okay, well, it was really rewarding to see all of the great experiences you've had and contributions you've made, and the next steps. It seems like you're on a journey, and you've learned a lot. It contributed immensely, and it's just the beginning. So we congratulate all of you, and look forward to hearing about you and your research in the future. Thanks so much. And so I would just like to thank everyone, all the participants who are here today, also for joining, and look forward to seeing you at our next event, which is on gender as a dimension of inclusive innovation with Jean-Jacques Rousseau and Davina Srivastava on Wednesday, April the 24th at 10 a.m. And please visit our website for information. So this officially ties off the symposium today. So thank you so much.